Thank you very much, Pastor, for opening up your church to us and coming here late on an evening. This is great. And I apologize for the way I'm dressed. This actually gives me street cred, right? Because I just came from work and I'm on my way home. I do want to also thank the council member because and we just talked about this before he spoke, but he gave us a certificate of recognition for our unit that we had started in the San Fernando Valley after it was open for a year, and came and gave us an award when he was with the Assembly. So the award came from the State Assembly, and it was about the work that we were doing in preventing amputations and diabetes. And that's really my passion. I mean, I've been doing this for several years in California now. I was recruited to California just to set up these centers, and we've been successful in that. We've now opened another center, and that's in Sherman Oaks at the hospital there. And our whole focus is on how to prevent somebody from losing their leg from diabetes. And the interesting thing about just the way that your brain works is that this is how much mobility means to people. And we know that humans, the reason why somebody is a human is because they walk on two legs, and that's what makes you human. And if something happens and you have to amputate someone's leg, and they now have to get around in a wheelchair or on crutches, or maybe after a while in a prosthetic, they really feel less than human, and they are reliant upon their family members to get them around. They feel reclusive and they're stuck indoors, and there's a very high incidence of depression afterwards. And the mortality rate after losing your leg is 68% in 5 years. 68% of those people are dead in 5 years, and that's not because cutting off somebody's leg is going to kill them. That's because these are generally very sick people, and after an amputation, you force a somewhat sedentary life upon them, and they have a quick demise after that. So we do all that we can to not only prevent that limb from being lost, but get them back to the full activity that they deserve, and to be spending time with their families. I do want to address a few things about the Affordable Care Act before I leave, because I consider myself somewhat of a subject matter expert on it. I ran for Congress last year in the district that is just north of here. That's Santa Clarita, Palmdale, Lancaster, pretty much everything north of the 118 in LA County. And I'll say that the reason why there's a lot of criticism, and you see it on TV, is there's always a little bit of truth in some of this, and that's why it sticks. And that's why some people, you get somebody that comes on TV and tells you their story, and they're not making it up. They do have a story. There are people that are affected by it. I lost my own insurance on the 1st of December. As a result of the Affordable Care Act, actually, but it's not. And I'm a big supporter of the president. It's not that the president and the Congress knew that some of these things were going to happen. What's going on is that insurance companies, and this is why I'm a big single payer system proponent as well. I think that we need to move our country in the direction of having a single payer system. We need Medicare for everybody, and that's going to be the end goal, I think, of anybody who's a real proponent of healthcare and health reform. But what's happening is that the insurance companies are still in charge of everything. And when an insurance company gets a law, and the law says you have to follow these 10 points, otherwise you can't offer that plan, you're not in compliance with the plans, then the insurance company has to make a decision. The decision is either, if my plan had 9 points that were compliant and 1 point that wasn't compliant, and they have to make a decision, either fix that 1 point or send me a letter that says your plan is out, now you get to choose a new plan, and it's much more expensive. And that's what's happening to a lot of people that have the type of insurance that I have. We had a small group plan, and a lot of small groups got their plans canceled, and that in California up to 1 million people had their plans canceled. And it is a result of the Affordable Care Act, but it's also a result of the greed of the insurance companies that are looking to take advantage of this. The other thing is this is what I want to tell you, and I think that you as counselors and talking to people about their health insurance, I think this is really, really important. The president said, if you like your health care plan, you can keep it. And it turned out to not be so true And again, not because he didn't think it was true when he said it, it's because of things that the insurance companies are doing now to make sure that they can still have the power to throw somebody off if they want to. But he also said that if you like your doctor, you keep your doctor. And that's probably true, but I think what your advice to your clients and your patients and your friends and your parishioners needs to be that they actually have to educate their doctor about some of these plans. And this sounds kind of weird, right? Why would you have to educate your doctor about some of this? And the reality is that doctors don't have a lot of information on the new plans in the exchange. There's not been a single meeting that I've been to, medical meeting, where they've said, hey doctors, here are the 10 plans and this is how you sign up and get involved in them. And so there are not many doctors that I know, not many of my colleagues, that are actually participating in any of the plans. And so doctors have to actually go out and become participants in the plans, and then the patients can keep their doctors. And so that if you really like your doctor, you have to really go that extra step and encourage them to be involved in that plan, because it's not just automatic. And another reason is insurance companies won't want to have every doctor in all these plans. So let's take Plan X that might be offered in the exchange. One of the ways insurance companies can save money is by not giving you access to all the doctors. Because that doctors, they feel like not necessarily that the doctor is expensive, but the doctor might order a test. That test might be expensive. Maybe you put you in the hospital, that might be expensive. So they figure if they can limit your access to doctors, that's one of the ways that they can save money. And that's how HMOs work, right? HMOs only have a limited network. You can only go inside that network. You can't go out, and that costs a lot of money. So what they're doing is even doctors who are trying to sign up, they're not always granting them access to these plans. And that's wrong. And I think that any doctor should be allowed to see any patient. That's what Medicare is like. Medicare patients can go anywhere in the country and see any doctor that accepts Medicare. And I want to work to see that happen in our country as well. So I thank you so much for having me out. And again, Pastor, thanks so much for letting us use the facilities. There's a couple of questions, I guess.
The two medical associations for the doctors in the country receive grants specifically to educate the physicians and the doctors in the country. So I don't understand why the doctors don't have more information. They have to utilize their medical associations.
Well, the American Medical Association, the participation in the AMA is used to be 18%, but it's a lot lower now. It might be somewhere around 15%. It's only 15% of doctors are even members of the American Medical Association. So that they may not get access to it that way. And the other thing is that doctors are just real busy. They go to work, they go home, and they get to spend whatever little time they have with their family, and that's it. The average doctor works about 80 hours. So that's a long work week. And so I think that they rely upon practice managers to manage their practice, because a doctor doesn't want to go into a room and have to sit down and say, this is a surgery you need and this is how much it's going to cost. And if you ever ask a doctor how much anything costs, the first thing they'll tell you is, I don't know. Because they really don't know how much anything costs. They make a couple of checks on a form after you get out of the doctor's office, and it goes to a biller. The biller looks at it. The biller then processes it and bills your insurance company first. Your insurance company then says, we have a negotiated price with this doctor, and this is our price, so we're not going to pay this, we're only going to pay this. Then after they pay it, if there's anything left over that's within the contract rate, that goes back to you, and then you get a bill 3 months later, and you forgot even why you even went to see that doctor. That's true. That's one of the big problems in the way that the system works. And so the real reason is that doctors don't necessarily make all the financial decisions in their own practices. So that's an issue. And then they don't always have access to all that information. So it's a problem that has to be overcome, and we just have to figure out a way to do it. But the best way to do it is single payer healthcare, because then everybody's in. Minerva?
A lot of times we're hearing that there are separate groups of just doctors and nurses that are fighting Obamacare, as we know, affordable care. But the concern is, how do we as consumers know whom to listen to on that? Because we're hearing echoes on this side that single payer is the best way to go. On the other side, they're hearing, affordable care doesn't work at all, so we don't even bother. And then they're also selling to us that the reason that the doctors don't want to go along with this is because it means they can't make as much money as they have been in the past. I know it's three things.
I think some of what you say is true. There are a lot of doctors groups and you know, you have to look at, you can't look at doctors as just a group of faceless people that don't have any political affiliations. There are a lot of doctors that are very politically active. And some of those doctors may be affiliated with a party that doesn't like the Affordable Care Act, and they may use their position as being a doctor to get out there and talk bad about the act. Now, I try to be very, you know, I try to remove any type of party affiliation when I talk about healthcare, because that's kind of my job too, is to help give people the best advice possible. And I think that I can identify, there are weaknesses in the Affordable Care Act. I can identify weaknesses and give some ideas on what we can do to make it better. But there are also some real strong points of the Affordable Care Act, and I think you need to be able to identify both of those. And anybody that tells me that it's all roses or that it's all thorns, I don't believe any one of them, because there are good parts and there are bad parts, and the right person is probably able to discern the difference between the two, and how and everybody should say, how are we going to make it better? That's you know, I just want to move forward. I want to make progress and move forward. But you know, I think that it's probably true if somebody tells you, and they may not be saying this for the right reasons, Minerva, but if somebody tells you that the Affordable Care Act is going to fail, I think the Affordable Care Act probably will fail in the future. And it's not going to fail. I know that may not be a popular thing to say here, but it's not going to fail because we're not trying hard enough, or that it's not doing what it's designed to do. It's actually doing what it's designed to do. But when you look at the cost curve for how much money our country spends on healthcare, we spend 17% of everything our country makes. We spend 17% of that on healthcare. That's a lot. That's twice as much as the next highest country. And we're spending all that money on healthcare. And so we're not able to contain the cost of healthcare. Now, the Affordable Care Act doesn't actually change that curve. When you look at that, how much money every year healthcare rises and rises and rises, before the Affordable Care Act, it's like this. After the Affordable Care Act, exactly the same. It doesn't change the cost curve of healthcare. One of the reasons is because the government can't control the prices, because the bill was watered down enough. There are 161 Republican amendments that were accepted to this bill. So whenever somebody tells you that this is a Democratic bill, it was passed by Democrats. Not a single Republican voted for it, but 161 Republican amendments were added to it that made it a lot weaker than what it should have been. I'm disappointed in the way that happened. You know, I think that if the Democrats had a vision and they wanted single-payer health care, they got it passed all on Democratic votes. They should have just went for it the way that they did, because they took a lump in the polls in 2010. They still would have taken the same lump in the polls if they had done a single-payer system, but we'd be a lot better off now. So now we have to work through this issue. The reason why I think it's going to fail, it's not going to fail tomorrow. It's just that cost curve is going to continue to rise. And in maybe 10 years from now, healthcare is going to be so expensive still after the Affordable Care Act that average people are going to say, I just can't afford this anymore, and give me single-payer healthcare. So it's going to go from, I think, the Affordable Care Act to single-payer. Maybe that's not a failure, but when people say it's going to fail, I think eventually the Affordable Care Act will, in itself, healthcare will still be unaffordable, and we will get to a point where the government has a lot more control on it. And a lot of this has to do with just the way that people consume healthcare. You hear about some people saying, we need a capitalist society, and we live in a capitalist society. We need a capitalist, market-free healthcare, but that's impossible in healthcare. You can't go, if you're having chest pain, you're not going to look up on the internet and see which hospital offers you the lowest price for chest pain, and then when you walk in, you're going to say, well, can I negotiate my price with you on this chest pain visit? You're going to go in because you're sick and you need to get cared for, and you don't even know how much any of that stuff costs until 3 months later. That's the problem. There's no such thing as free market in healthcare. So we need some regulators, the government, to be able to control that for you, so that you're not stuck with this big bill afterwards. And it's sad in our country. There's more than half of all bankruptcies in our country are caused by healthcare expenses. And nobody should have to bankrupt their, to mortgage their house or have to go bankrupt in their last few weeks of life and leave their children nothing. That shouldn't have to happen. And I think that the Affordable Care Act doesn't quite get us to that point. It is a step in the right direction, and I'm critical of some of the parts of it. It's a step in the right direction, but only when we get a single payer system will we have fully evolved our healthcare system to a point where it's not only affordable, but it's also equitable for people.
How are they going to be addressing the massive obesity rate and the massive climb of diabetes in this country and start containing it? It's extremely expensive to keep somebody in that state instead of curing them.
Right. Well, let me tell you, we're going to spend, in the next 10 years, we're going to spend $2 trillion, trillion with a T. Now, this is a lot of money. We spent $1.4 trillion on both the war in Iraq and the war in Afghanistan combined. But we're going to spend $2 trillion on diabetes, obesity, and cardiovascular disease. Those three diseases. They're chronic diseases. Now, the interesting thing about those three diseases is that they're all three preventable. And diabetes, for the most part, there's type 1 diabetes, type 2 diabetes, but type 2 diabetes is preventable. Then those three diseases are all caused by the same two things: poor diet, lack of exercise. And a lot of it's due to the changing makeup of the American lifestyle and the world lifestyle. Obesity and diabetes is raising across the world. But let's say that you're truly a fiscal conservative, you're a hardcore Republican fiscal conservative, why wouldn't you say, well, if we could save $2 trillion by just putting a little bit of money into the prevention side, why wouldn't you want to do that? So that's what gets me sometimes about fiscal conservatives, because they don't see a dollar spent they don't look at the savings down the line. They just say a dollar spent is a dollar spent. And if you say I can spend a dollar and I can save $10 in a year, that doesn't go for them. And I look at it and I say we need to make sure that not only is that good medicine, it helps to make people healthier, but it saves us so much money. Look at what it costs for dialysis, on somebody on dialysis or losing their leg or going blind from diabetes. All of these things that could be saved just by putting a little bit of money and a little bit of effort into preventing them. Some people complain that you might make a nanny state, right? Are we going to tell you what size of soda to drink? Are we going to tell you that we can't fry your fries in trans fats now? And we might need some of that. We might need a little bit of help, because how do you know what trans fats do to you? You need somebody who's a panel of experts to say, look, this stuff is really bad. You can still have good tasting fries, but maybe let's not put trans fats in there.
Do you think there'll be some kind of, I want to say, enforcement isn't the correct word, but for example, you need to have the lap band, or you need to have some gastric bypass because you've got to start losing some weight fast. Do you think there'll be some kind of...
I think most insurances now are covering those types of surgeries because they do know that those are necessities. So losing weight fast is not always good either. And I'm not an expert on obesity, and I'm not an obesity surgeon, but I think that we need to make those things available to people. But the best way to do it is just to prevent it from happening in the first place. And that starts in the schools, that starts in communities.
It also affects not only this lifestyle, but we have public schools who have cut the funding for physical education and recess. Not to mention the corporations of America that have made their money primarily because they serve unhealthy, fatty foods.
Yeah. Do you know? You're gonna think this is very sad, because I do. Do you know that pizza is considered a vegetable?
Yes.
Did you hear this?
Yes. And ketchup too.
Yeah. And it's true. Congress actually passed a bill that says pizza is a vegetable. And they did that because the frozen food lobby was worried with the new standards that they were setting up in schools, that they would not be able to, frozen food companies would not be able to sell pizza in schools anymore. So what they did was they passed a bill that said pizza is a vegetable because it has 2 ounces of tomato paste on it, and that makes it a vegetable. And so so now they can still serve pizza in schools, you know, and I'm sure all of you eat pizza. I like pizza, but I don't eat it every day, and I'm not gonna, I certainly want my kids to grow up learning how to have a healthy, balanced meal, and I'm not really sure that these type of foods should be served in schools. I also don't think they should be served in hospitals. Some of the worst food you get is served in a hospital cafeteria, you know. All right, well, I have another event in Simi Valley, so I'm going to go to that event, and I appreciate everybody's time, and I wish you guys a happy holidays, and thanks again for your hospitality.
Thank you.
Okay, thanks.